G'day everyone, this is Health Highlights. I'm Simon Ashley. Health Highlights is a show about health professionals, and the people and the stories behind the names that we hear about but we seldom get to meet. And last week we had an amazing interview with Dr. Andrew Gardner around concussion. And he's joining us again. Welcome, Andrew.
Thank you. Great to be back.
Today what we really want to do is we just want to focus in a little bit and be a bit practical.
Yep.
But firstly, there's been a lot of changes in the NRL and in the union around head concussion and all that type of thing. And there's also a movie that came out called Concussion. Now, a lot of things are changing in the area of concussion and sport. How accurate, firstly, was that movie? And what is the reason for the changes in the laws in the sport?
Yeah, so the movie, I think Hollywood took a little bit of poetic license in terms of embellishing the story a fair bit. So we've kind of said that that movie's probably set our educational program back a couple of years because we're trying to teach the community a little bit about what the potential long-term consequences are, and they went to the extreme level of what can potentially happen. So it wasn't fantastic. It's probably good entertainment value, but I wouldn't like everybody to leave the movie cinema or hire the video or the movie and think that that's what's going on, because that's not really the case. If we have a look in Australia and you went to a nursing home, you wouldn't see it filled with former rugby league and rugby union players. It's not as prevalent or as bad as what the movie makes it out to be, but we're still studying it, so we need to find out a lot more information about that for us here in Australia.
And so what about with the laws that have changed in recent times around sport? What was the catalyst for the change?
Yeah, I think really athletes themselves taking responsibility a lot for what they're doing. The doctors who are looking after team medical professionals, and also the sports themselves, recognising that there is an issue, that it needs to be dealt with well, and gradually more research coming out and us adopting our policies around that research and really trying to put players' welfare as the paramount concern. And I think that probably always has been the case, but I think the topic has just become at the forefront of a lot of people's minds now, and so steps are being put in place to really enforce some of the policies that have been around for a long time. And I think that it's probably more the public are probably more aware of it now because they can see that it's being enforced and there are ramifications for mismanagement now.
And on that, look, I've played football, and it's almost like a badge of honour, and you talk about this in one of your papers, it's almost a badge of honour to have a concussion and get back on the field and keep on playing. So is there consequences, though, for players, particularly in the junior levels, of doing that sort of thing?
Yeah, so I think that's a culture of really collision sport in general, that people don't want to let their team down, they don't want to let their coaches down. When you start to get to the higher levels, you need to be on the field to get your next contract, and you need to be performing well because that's what you're paid to do. And so there's a lot of that still goes on, used to go on a lot previously, but now people are really, as I said, taking responsibility for their own health. Other people are making rules and policies that need to be enforced to make sure they're looked after. At any level, doesn't matter whether it's junior, grassroots level or at the professional level, we need to be managing every concussion well every single time.
And look, and that's a really good point. So, I mean, pretty much you say here, one of your quotes is, sometimes we need to protect players from themselves because they're warriors, they're out there, they don't want to let their team down. So it's really up to the parents, the coaches, and even the players themselves to actually protect these guys who have had head injuries. Yeah. So what are the things that they should be looking for, and what would you suggest for them to actually put into place to say, you know what, you need to go off the field?
Yeah, so a lot of the time some of the symptoms are what we call covert, which means that the individual who's concussed is the only person that knows that they've had a concussion. So we need to, from that level, educate the players about what signs and symptoms need to be seen or felt in them that would meet criteria for a concussion. Now, one of the things that I'd like to stress as well is that we're not looking to diagnose a concussion to get a player from the field. If we suspect that a concussion has occurred, then we're removing them from play. We need to be very, very conservative in our management. If in doubt, sit them out, basically.
Wow.
So if you have a player, or you're a player yourself and you're listening today, and you take a blow, doesn't have to be to the head, could be to the body, you could get a whiplash-like injury, and you have any kind of normal disturbance, so you don't feel like you're quite feeling right, you feel a little bit dazed or stunned or dizzy, you're seeing stars or have any kind of blurred vision, you have balance problems, you have a headache, your memory's not quite right, you don't really know where you are for a few seconds, or if you black out even for a millisecond, then that's an indication that you may have sustained a concussion. As I said, you don't have to make the diagnosis. If you think you've sustained one, then you need to put your hand up. We need to remove you from play, and we need to be referring you on to medical support to be managed through to return to life, return to the classroom if you're at school, return to university, return to work, then get you back on the sporting field.
I mean, I guess that is also relevant for kids at home if they fall off a tree or any of those things, those criteria, or if you like, that line in the sand. And I suppose that's my next question, is we look at the professional codes.
Yep.
What is the line that they draw when they say, you know what, you can go back on the field, or no, you know what, you need to sit off? So can you clearly define that line for us?
Yeah, it's hard to clearly define it, because it's really, concussion is a clinical diagnosis. It's not really based on constellation of symptoms or signs. You don't have a objective test where you could take a blood test and find, oh, that's a concussion, that's not a concussion. We don't have that objective measure at the moment, and there's a lot of research going on looking for that answer. But what we do have are, at the elite level, professional, medically trained professionals who are making that decision based on what they see on video, what they've witnessed, what other people have told them, and how a player performs on the HIA, or the head injury assessment that's being conducted. So they have some objective tests, they have some expert opinion and clinical, to make that clinical diagnosis.
And so what are some of the tests that they, like, what do you ask the players to actually test them?
Yeah, so orientation questions, so where you are, who scored last in the game, whether you won or not last week, just really getting an idea of what their memory is like and their orientation. And then you do ask some specific memory questions, so you might give them a list of words to repeat back to you. We do some balance testing as well. We also typically check the neck and make sure there's no other injuries in terms of that. And then we also looking at, well, I said balance, but we also do testing of gait, so walking. And then we need to know what the player was like before they sustained a concussion, so we can make an interpretation of those results. So that's important as well.
Okay, so let's just say that you suspect a player has had a concussion.
Yep.
What's the best management then and there in the game?
Yep.
And then ongoing from there?
Yeah, so immediate removal from play so that they're not exposed to a second knock. So we need to be getting the player off the field. We need to be monitoring them, making sure that they aren't vomiting numerous times, that they're not going in and out of consciousness, or their signs and symptoms are deteriorating. If you see any of those signs, they're red flags to get to the emergency department, because something more sinister may be going on. So we need to be very aware of that. But it is important just to remove them from play so they're not getting a second knock. They're not keeping their heart rate up nice and high and the symptoms getting much worse for them. And then we're monitoring them. We are getting them to rest. So for usually the first 24 hours to 48 hours, you're resting. And that means physical rest, so no physical activity, as well as cognitive rest. So that means thinking skills, not doing much. You're not sitting there watching television or movies and saying that that's rest. You're not sitting on your phone. You're not sitting on a tablet or other devices. And so we're really looking to rest both physically and cognitively, and that gives us an opportunity to maximise our recovery in those early stages, and then gradually get back to your normal life after that. And
so that's the next question. So we've managed them.
Yep.
So when do we know when the right time is to get back into normal life?
Yep.
How do we determine that?
Yeah, so it's important to but have a look at symptoms that are occurring. So if you've got a headache, but it's gradually getting better over time, then that's kind of moving in the right direction, obviously. If you've got a headache and it's going fluctuating up and down, then we need to monitor what activities are making it feel worse and stop doing those, but still start doing activities that are okay. So in terms of returning back to, say, the classroom for children, we might find that they have Monday and Tuesday off school, and then on Wednesday morning they go to school until midday, and then they come home and they rest. What you'll find is typically when you start to go back and do those activities, you get much more tired, you're finding it hard to concentrate. Some of the symptoms may come back, so we don't want to push that too hard at that point in time. And so we just have a gradual return to activity, and that also includes gradual return to sport as well. So we don't start doing any kind of sport activity and gradual return to play until the symptoms have completely disappeared. So that's what we need to be monitoring.
And so when is it that you would go and see someone like yourself? So if you've had a head injury and things are going, but like, do we go straight away? Do we maybe see how they go? Like, what is your advice around that?
Yeah, so I think it's important just to reinforce again that when the injury occurs on the day that you're monitoring that person for the rest of the day and making sure that they're okay, any kind of deterioration of symptoms, straight to the emergency department. Now, typically that's not needed, but you do need to monitor the person. They'll have a sleep that night. You make sure you go in and check on them, make sure they're okay, still breathing and everything like that. In the morning, see how they're feeling. And if that's a Monday morning or a Sunday morning, then typically we would get a referral to our clinic here at in Newcastle, and we would see the person on the Tuesday. So that's when we run our clinic, and that's when we typically see people 48 to 72 hours after the initial incident. We do an assessment, talk about a management plan, talk about whether their recovery will be sufficient for them to return to play, probably not in the next weekend, but the weekend after, and then manage it from there, manage your return to work or school or university, and also your return to training and match play.
And so your advice then is, if you had a concussion, to not play the following week?
Yep. Typically, or if you play rugby union, there's already criteria in there that you have a mandatory sit-out period. But if you're playing other collision sports, it's highly unlikely. I think we've mentioned before that 7 to 10 days is the usual pattern of recovery. So it's highly unlikely that you would be fine to return to play the following week. And there's also universally accepted graduated return to play. That's a 6-stage process. Each stage takes 24 hours. You can't start the second stage until you're asymptomatic, so all your symptoms have disappeared. So if it takes you a couple of days for the symptoms to go away, you can't get through stages 2 to 6 before the scheduled game next week.
That's
anyway.
great. That's really great, clear advice there. And finally, helmets.
Yep.
How effective are they at actually helping and protecting our kids' heads? And is it important that the kids wear them? Or what's your opinion?
Yeah, so there's two schools of thought, I guess, and I'll share both of them. It's headgear for rugby league, rugby union, Australian rules football, those kind of contact sports tends to be pretty good for lacerations, abrasions to the ears and those kinds of things. Could potentially prevent a skull fracture, although that typically is very rare. However, for concussion, they're currently available products on the market do not reduce your risk of concussion. The forces that are applied to the headgear still go into the head. The brain sits in fluid around the skull. The skull is very, very hard, as you know, it's bone. And so when the forces go in, the brain is still moving around inside the head. It's still whacking against the surfaces. The brain has different densities as well. So although I'm holding it like this and moving it like that, they actually move in different movement as well. So there's lots of injuries that can occur there. And basically the headgear that's available does not attenuate those forces such that no movement goes on. So at the moment, not going to reduce your risk of concussion for those collision sports.
Well, there you go. What a fascinating interview, and I'm sure you got a lot of great practical information for your kids, for your players, out of that today. So thank you so much, Andrew.
It's great to be here. Thank you for having me.
Really appreciate it.
Cheers.
Look, thank you for joining us. Next week we're going to have an amazing interview lined up for you. So remember, 12:30, same time, Wednesday, same place. Remember, healing is a gift, health a responsibility. Have a great week. See you later.